Hello, and welcome to the first ever Health Without the System podcast. I'm Dr. Tim Scott, and sitting next to me is my wife, Mia.
Hey guys, my name is Mia, and I'm a nurse practitioner here with Rixa Health, and we just wanted to take some time to introduce and discuss who and what we are as a company. Tim and I are the smiling faces and the operation here at Rixa Health, but we're going to talk a little bit about our company here at the end.
Yeah, I think, what's probably a good introduction is telling people who we are, maybe our medical background, how we got to where we are, and, what made us decide to start this Rixa Health company, and more importantly, what made us decide to start this podcast.
Yeah, so going back many years ago, I have a background in emergency medicine, so does Tim, and he's actually still in the ER right now, but I started in emergency medicine, then I went to family practice for my nurse practitioner degree. And when I went to school, I realized right then and there that this would never be the path that I wanted to take. It's really pill for an ill. I always wanted to know the why. There wasn't really a why. It was a diagnosis for an ill and a pill for an ill. And you'd go off of, some symptoms and things like that. And then your patient would leave with medication. And there was really not enough, not only time, but resources for educating your patient on that what they had could be truly reversible. So I didn't even bother with family medicine, and then I went into the wellness world. So back in 2020, we had a wellness clinic that we opened up, and I worked there for a while, and then we branched out in telemedicine. And that's when we really started to become passionate about the wellness world and functional medicine and root cause and really helping our patients not rely on so many medications for their health problems.
Yeah, that's a lot to digest. That's like so many years into one there. So agreed. I went to medical school at Lincoln Memorial University in East Tennessee, and I really got to see sort of the end of old school medicine. There were doctors there that were still making house calls, but it was very personalized, a lot of one-on-one attention. And I think that as I got into residency, I did my residency at Detroit Receiving Hospital. And as I started to practice through residency and as an attending, you really realize that touch was getting lost. And obviously it's a little bit different when you're talking about primary care and emergency medicine. But with me, over 10 years, 12 years of practice, I'm seeing the same people coming in the emergency department. I'm seeing different people with the same illnesses. I'm thinking, you're telling me I go to my primary care doctor, I take the medicine I'm supposed to do, but I'm not getting better. And I'm here in the ER again. Or even if you're doing everything right, you still feel sick. And, with a lot of probably prodding from you and you really driving into that wellness world first, I think you sort of pulled me into it, making me listen to different things and read different things. And that's when it, started to click for me. And I've also said, but why? What's the root cause of illness and how can we address that?
Yeah, and I've always been a podcast person. I mean, I've been listening to podcasts for probably 7 years now, like quite literally every single day. That's my background music. And that's when I really started to get passionate. Just started following a bunch of wellness providers or people who, unfortunately, I feel like a lot of people who get into the wellness world were because of an injury or something that happened to them, not just a passion. And so I feel like we've gotten really lucky with that, where we kind of just dove in based on recognizing what we were surrounded with, the emergency medicine, the very, very sick and helpless patients, especially in primary care. When I did my rounds with primary care, you only had like a 10 to 20 minute slot. You had one request to talk about that was wrong, and then that was it. So
yeah, it's kind of funny because, you mentioned I didn't see myself in primary care, and I was the same way. That's what actually drove me to emergency medicine, that like energetic, I really want to help people. And we've almost made a complete 180 because I think I've realized over the last decade that primary care is actually where it's at when you can do it right, when you can sit down and spend time with people, when you can go over their diet, their lifestyle, when you can teach them things. And unfortunately, the way our medical system is set up, it's really just about speed. How many people can you see? What can you prescribe? What metrics can you hit? And I think, we could talk about this more later, but I think that's kind of what led us to the name of this podcast, which is Health Without the System. The system's broken and we really want to do better.
Yeah. So we can talk a little bit on why we headed into the functional medicine approach. And like I said, there was no actually like major event that turned us into the wellness world other than just how like purely exhausted we were. Another company that I just want to say that I worked for, I used to work for an insurance company that was just basically you would spend like 60 minutes, which felt like a lot of time to spend on a patient, but it really wasn't like the appointment that you thought. It was basically going over their med recs, making sure that if they needed refills, they had refills, and then basically putting them in this like criteria of if they were ready for new necessities. So for example, if they're diabetic and they had like an ulcer, but they didn't quite qualify for a home nurse until their foot was like much more necrotic. And I was just so sick of that, like basically telling these patients, like, you don't apply, you have to be sicker than this yet. And then they kept saying like, I'm paying all this money, what is my coverage getting me? And I'm like, well, essentially nothing until you're a little bit more closer to death, which is horrific.
And isn't that kind of what the primary medical system is driven around now? It's more, we call it sick care, right? Because there's not a lot we do for people when they're healthy. Let's say quote unquote healthy. As a matter of fact, think of your average 30 to 40-year-old who goes to see a primary care doctor. They're going to put a stethoscope on your chest, maybe push on your belly, say, okay, everything looks great. They might be overweight. They might be telling the doctor, like, I feel tired a lot. I feel fatigued. The doctor runs some labs and says, nope, everything looks good. And I think, you mentioned we kind of went down this functional medicine pathway, and now we look at things through a functional medicine lens, which is analyzing it a little bit closer. And, we should probably mention that we are both in training for functional medicine. I'm hopefully going to finish that up soon. We're both going through the Institute of Functional Medicine, and it's definitely changed us.
Yeah. And, it's been, like I said, it's been a few years that I've really dug into the functional medicine. It just took me a little bit longer thanks to a couple of kids that I had. But nonetheless, when I started to completely look at the body as an entire system, addressing root cause, yes, we're not opposed to medication. It's still using them as a crutch, but not a Band-Aid. And there's a big difference with that. I mean, this will probably be a podcast in itself, but just recognizing some of the ways that this has failed my loved ones as well. There is many people close to me that I was able to help treat with functional medicine that Western medicine completely pushed off or gave them the absolute wrong information. And this goes back to many years ago with a cancer diagnosis with one of my aunts, and just saying, like, this is so wrong that the way that they're doing this. And then, once your ears perk up, you start to pay attention to your surroundings and what's going on. And then once you're in the hospital, it's like, this is all wrong. And of course, there's a way for, emergency medicine. Like, obviously that is absolutely needed. But the other stuff, like the functional or the primary care, like getting into that world, it's just like, we need so much change.
I agree. And I think a lot of us in this functional medicine world agree that we do have a really good actual sick care system. If you get acutely ill, if your appendix is rupturing, if you're in a car accident, our system is great at taking care of you in the short term. I think it is the long-term care. It's the primary care. It's the prevention. It's the lifestyle changes. We're going to do a little segment later that we call statistics, and we'll talk a little bit about some of that some more, so I don't want to steal the thunder. But let's talk for a moment. What is our goal for this podcast? As a listener, if you're listening to this right now thinking, am I going to come back each week? Let's tell them what we want to convey and what we hope to achieve.
Yeah, so I think given the name, The Health Without the System, we're two medical providers that recognize that we love taking care of patients and we love learning about the body and everything medical, but we feel like that the system is completely failing our patients the way that it is now. Everybody knows the insurance, there has to be change. It doesn't go unrecognized. So we want to make sure that we're each week bringing you guys, or when we do these podcasts, bringing you guys knowledge to where you can understand your body a little bit more and learn the information out there that your provider might not be telling you. And that's your baseline metabolic function. That could be doing more natural remedies. That could be statistics on really how sick we are as a population. And your doctor might say, hey, your labs look great. When, just this last week, I diagnosed 4 different people with diabetes when their provider did no further testing, didn't think it was needed. It's things like that where we want to give you the resources so you guys can go and be an advocate for your own health because it's needed.
One thing I always say is that you have the power. Right? You as the person, you as our listener, you have power. You have power to speak up for yourself. You have power to ask questions to your physician. And these little things do change the system. What you need is the knowledge. You need somebody to break things down. You need somebody to tell you what to look at. You don't know what all these labs mean. And somebody who's experienced in it might be able to say, hey, this is what you look for. We'll do certain segments where we go over common lab results. We'll do things where we break down complex topics. We'll take requests. But I like to think of this as introducing to some while reinforcing to others the power of the human body, power of plants, nature, most importantly, your diet. I mean, there's so much lost emphasis on the diet. And I think it's making a resurgence, but I think it's making it in certain circles. And people like us really want to bring that to the mainstream. And I hope that with the podcast, all of those concepts we can continue to cover.
Yeah, and we're definitely big on food, and I think that is so overlooked because I feel like it's a term that's used so commonly now, like, what is your diet? Where people are like, I'm eating healthy. But and really until you dig into what the patient is actually eating, you're like, I'm sorry, but you're really far from the truth of what you're eating. It's not healthy.
Yeah, so Mia mentioned a few minutes ago how back in 2020, we opened a wellness clinic. We actually opened one before that. We opened a float spa where you kind of float in salt water. And that was sort of, I'm an osteopathic physician, so in my training, we always talked about the human body as a whole. It's a little bit different than the allopathic route. We did manipulative medicine, and you do try to bring that whole system approach, but not nearly like the functional medicine world does. And as I started to want more, this would have been about 2017, I really liked this idea of floating for mental health, anxiety, and even pain and relaxation. So we opened that, and then 2020 came, and this was right around the time of COVID. We actually opened another business that it's called Restore Hyper Wellness. It does IV drips. It's part of a franchise. It does IV drips. You can do cryotherapy, red light, compression, lots of cool stuff. And they're hyperbarics, mild hyperbaric therapy. But it's franchised, and we were kind of constrained by that franchise. And that kind of leads me into our soiree into telemedicine, as we realized during the pandemic and after how big telemedicine was and how it was going to become. And Mia and I started with jobs for different companies on there. One of them was GLP-1 medications. And when you couple franchising and the constraints of franchising and telemedicine and the constraints of working on other companies, we started to realize there's gaps, there's things we can do better. And I think that's what led us to Rixa Health, which we can talk more about. But I think it's important to mention, you said, people say I eat well. We'll get that so much on some of these companies. Someone will respond that they're not doing well, and we'll say, what's your diet? And they'll say, I eat fine. And that's it. Yeah. But you're like, what does that mean?
Right.
I mean,
but they ate their Cheerios. I had a patient tell me that his doctor said he was eating a very healthy diet and he couldn't lose weight, was diabetic, couldn't figure out why. He was blending his Honey Nut Cheerios with his fruit and milk in a smoothie, and that was his smoothie for the morning. And I'm like, sir, you're eating a bowl of glyphosate with some sugar, zero protein. Your glycemic spike is going through the roof, yet your primary care told you are A-okay, buddy, especially on your refill of your soon-to-be insulin. So that's what it drives me nuts. It happens all the time.
And let's point out something that I think is extremely important here. There are a lot of times you might hear us in conversation and on this podcast mention something about a primary care doctor doing this or not doing this. We are not at all against or blaming the majority of primary care doctors, right? In every profession, medicine or anything else, and even within medicine, even within emergency medicine, there's good doctors and bad doctors. Primary, there's good doctors and bad doctors. The point is, we are victims of a system. And until Mia really pulled me into this more holistic approach, this functional medicine approach, I was intertwined in this system. We are trained by Big Pharma. Big Pharma dictates kind of the medical school education, the residency,
the funding,
the protocols,
yep,
everything. And you don't know what you don't know when you're stuck in this system. So at times, if you hear us say something, or point out what a primary care doctor did or didn't do, we don't want that to come across as us blaming that particular person, because they honestly might not know what they don't know. I know I didn't.
Yeah, and exactly. They want you, you are taught exactly what they want you to know to work with their algorithm. It is a business. And at the end of the day, unfortunately, as much as people say, like, my doctor cares about me, of course they do. But it is still a business. And they still have revenue to hit. They still have prescriptions to hit. They still have an algorithm to follow. And they don't have time. They don't have time to educate you. They have, like I said, you have one request and then you have to book a new appointment. Well, guess what? Who's not going to book an appointment? Them, because it's covered by insurance, and that extra appointment isn't going to be covered. So it's a very broken system. Yes, we have amazing providers out there, but they are just so stuck in that system that they don't know that there's an entire world out there that is completely different to how we used to practice or how we do practice.
Yeah, the medical reimbursement is not based on outcomes. It's based on hitting certain metrics, like you said. And I think that's one of the biggest problems. If we had a system based on outcomes, I think everything would be driven more towards that. Yeah. One of the things we mentioned as a goal of this podcast is give people the knowledge to speak to their providers, challenge their providers, and confidently ask questions about or suggest alternatives to traditional medicine, especially when it does not make sense. So let's talk about that for a minute. This is a very common thing. 40-year-old male, let's say overweight, like obviously obese, goes into the doctor and says, I don't feel good. I'm tired all the time. My joints hurt. I can barely get out of bed. You're 40 years old, right? And the doctor gets a couple basic labs and says, everything looks okay. How can we apply that concept of teaching you what to ask, how to challenge the system, especially when it doesn't make sense? Because that doesn't make sense.
Or when you say, I'm not sleeping well and I'm very stressed, and then they send you home with some trazodone and call it a day, when really you're a metabolic disaster, which I encounter very often with my patients. And then they get mad at their primary care and they're like, well, this isn't protocol. You're too young for this. We're seeing the most youngest population ever with fatty liver disease. I mean, we have such a poor health system, not only that, but our food system. And we should absolutely be assessing addressing everybody's metabolic health at younger and younger ages because we're seeing it younger and younger.
Yeah, it frustrates me, and you've experienced this I still work in the traditional Western medicine system every day. And when I try to speak up and challenge the status quo, I feel ostracized. I'm made to feel embarrassed. If I start talking about things like, hey, this doesn't make sense, or why are we prescribing statins to this particular person? Again, not to say statins aren't good for some people, but maybe not necessarily all the people that get them, especially knowing the side effects. A system has been created in which you are ostracized if you try to speak up and you try to just raise your hand and say, I have a question. This doesn't make sense. And isn't it so weird that everybody just wants to come down on you instead of saying, hey, that's a good thought. Like, I wonder if we could be doing this better.
Yeah. And we almost look like the black sheep for raising or, ruffling the feathers, so to speak, where really it's just well, it's because we've been doing this for a little while now. And I feel like we've found some solid proof on why we need to dig deeper in some of these patients, because once again, things are not normal. And if your body and your patient and they know their body and they're saying I don't feel right, this isn't normal, then you don't just do a basic set and say, well, everything looks great. Once again, that happened to one of my family members. Everything looked great. They did basic set of labs, and then symptoms were still chronically progressing after 2 years. And I finally got a hold of them, did a mold panel toxicity based on what they were saying, and critical levels in every single mold that I tested. And that's things we know there is a crap ton of evidence out there that mold is so damaging to our cells and our mitochondria. And it's testable. Why is that not something that is taught in Western medicine to also say, if we're going to do the side effects, symptoms, pill profile, then why can't we say, if you're feeling this, then maybe we should be testing for mold? Because that can lead to major disease processes, including cancer. So that it's a very frustrating time, but we are so happy to be coming out with this knowledge and really challenging patients to be their own advocate. And I always tell every single one of my patients, especially after a session that I'm diagnosing them with, things that their provider missed, years after years. And I always tell them, if you don't like your provider, fire them. You hire them, you fire them. And so if you don't like somebody, you can go to somebody else who's going to be a little bit more of an ear and willing to dig down and willing to say, listen, I have no idea what is going on, but I'm going to do a few more testings and see if I can't find this. Or, if I suggest a testing to a primary care and just simply saying, I have no idea what that is, but I will order it because it'll be covered under their insurance.
Yeah, I think that's a really good point, because it's a relationship, right? We talk about the provider and patient relationship, and not every relationship works out, right? Two people aren't always a good fit. And if you don't feel like you're being heard, or you don't feel like your provider's taking action, you should definitely look to see if you can find another person. And that's not doctor shopping. That doesn't mean, oh, my doctor's not writing the script I want. It means if the person's not listening to you, not looking deeper into things, not hearing you when you say, I know my body and something's wrong, can you please at least take a closer look? Because I think there's too much of that out there. Like you said, we get stuck in this dogma of, I did your basic labs, everything looks okay, what more would you like me to do for you? And truthfully, I think that all comes back to the fact that we're not taught in traditional Western medicine a root cause approach. We're taught to collect data, get all the symptoms that somebody reports, find the diagnosis that fits them, and then get the pill that treats that diagnosis. We're not taught to go backwards and say, what is causing the 7 symptoms you just listed to me?
And we're also not taught to teach the patient all the side effects that they can get from the medication that they just prescribed. And then they come back with something else. So for instance, somebody's placed on a statin, no medical history except some high cholesterol. They're on a statin. A few months later, they come back. My mind isn't right. I have brain fog. I just can't remember things. Oh, here's something else to help you concentrate. Not knowing that it was actually the statin that caused, some memory impairment. When this is all very clinically documented, that can be a side effect. So, and let's not forget that polypharmacy is one of the leading causes of death in the United States as well, which is where a provider can put you on a slew of medications, and just on top of the next, you have side effects, interactions, which can lead to death.
Yeah, I think it was one of the functional medicine courses, one of the providers said, imagine when you go to the doctor's office, there's a list of symptoms in the diagnosis manual that lead to depression. So let's say you're I have excessive fatigue, maybe I have some weight gain, I don't have enjoyment in any of my activities. When you check so many boxes, boom, it's depression. And then the next step is generally to put you on an SSRI, right? And what this provider said in the functional medicine course is nobody in the world has a a Prozac deficiency.
Yeah.
So why are we treating these symptoms with Prozac? And again, that's not to say that there's not a place for that with certain people, but why can't we stop there and go back to the root and say, okay, you mentioned you're not enjoying anything. You mentioned that you're tired all the time. Let's talk about your diet. Let's talk about your relationships.
Yeah, or give them the option. And that's the problem. Like a lot of these patients don't want to be on this medication, except there is no other alternative. Why? Because the providers are not taught any better. They don't know that there's other alternatives. So when they say you have high cholesterol or you have diabetes or you have brain fog or a mental health issue, it's not, well, do you want us to try the more holistic level or path? Because they don't know. They're not taught that. And I have so many patients come to me and say, I don't want to be on any of these medications. They make me feel terrible. I feel like a zombie. And I don't blame them. But they say that my provider said that there's no other treatment for this because they are not taught.
I agree. And I touched on this in my last comment, and I'll say it real here. One of my absolute favorite parts of functional medicine is that they focus on the mental, spiritual, emotional aspect of a human being, right? We have almost completely forgotten that in medicine. I want everyone listening to this call or listening to this podcast to think for 1 minute. When is the last time you went to a doctor's appointment and they stopped and asked you, what's your spiritual life like? Do you have a higher power? Do you have a calling? Is there anything that's keeping you moving forward? What are your relationships like? Are you happy with your significant other? Is there something, that you're needing to discuss? And how are you emotionally? Are you stable? Are you unstable? Are you crying all the time? Have any significant events happen? Do those conversations happen in medicine?
No, but they happen in the blue zones, which are the longest lived population. They are always in communities. They're always active. They always have friends and, people to just spend life with. And those are the populations that live the longest. Why? Because they're active. They eat well. And I mean, nutritionally dense, likely, farm raised themselves. And they have conversations in a community to build up those support. Those are the longest lived populations studied. And why aren't we driving our education and to focus more on how those populations live?
Yeah, I work at the majority of my shifts right now in a freestanding ER. And some days we're super slammed with low acuity, but high amount of patients. And I really have to move really quick. Other days I sort of have a little bit of time to talk to people. And I had this really nice 80-some-year-old guy come in the other day. And he had this venous stasis in his legs, and his legs were really swollen, really red. And in traditional Western medicine, that's almost always called cellulitis. They call it this superficial skin infection. Sometimes you get admitted to the hospital, you get IV antibiotics. And don't get me wrong, IV antibiotics do improve it, but they don't address the cause. The cause is blood flow, right? And I had some time to sit down and talk to this guy about it. And I'm telling him, I'm like, hey, I could probably admit you to the hospital today based on what I'm seeing, but I don't think you need that. I'm like, I think that we can do a few different things here. And he was really open to it. He's like, Doc, I'll do anything you say. And I had just remembered one of the functional medicine lectures that was talking about something simple like grounding, helping with blood flow. So red blood cells have a charge on it. And this doctor was explaining that if you do something as simple as grounding every day, you can actually improve blood flow by, changing the ion charge of red blood cells. So I talked to that guy about it. I actually suggested a natural remedy. I talked to him about the importance of movement. I'm like, you have to move. You have to get this blood flow in your legs moving. And his wife is like, thank you. I've been telling him that. Nobody's ever said that. And he told me, well, I'm not real mobile. And I said, well, what, have you ever seen a leg roller? Those weird contraptions that people roll out their legs. And he's like, no. That made him open their phone and find it on Amazon. And it was just really cool to have this conversation. And that guy walked out of the ER that day and went home instead of getting admitted on IV antibiotics and nobody addressing the root cause.
Yep.
I don't know, if that's going to turn out better or not for him, but it was a win, I think in the short term.
Yeah. And they appreciate that. Nobody wants to stay in a hospital, especially for their 10th time of the same diagnosis, because they have the same outcome. Every single time when they get admitted, it's the same outcome. Oh, I'm here for uncontrolled diabetes, even though I'm following my diabetes, protocol of the right food I'm supposed to be eating. And it's like, well, you're not getting better. Or my favorite, I'm type 2 diabetic. I'll be on metformin for life. And, per my doctor. And I'm just like, I want to lose my mind. I want to call your provider. What's their number? And so it's things like that where they just, and I truly don't think it's malicious. Like Tim said, it's not that we're, mad at the primary care. We're mad at the system that they were taught in, myself included, until you break through that system and you're like, dear God, look at this world out here. It seems so freeing that you're in this world that you can dabble around with some, plant medicine and things like that, that truly, medicine does come a lot of times from plants. Why don't we go to the natural source without all the side effects?
I agree. And I just have real conversations with my functional medicine patients. I say, hey, let's see how this works. I'm not 100% sure this is going to take care of every problem, but let's try this. And obviously, again, there's still a place if things are getting worse, if it doesn't improve, you can always go back, to the emergency department, to your primary care doctor. There's always a Western medicine approach, but it's really cool to see this functional medicine side of things.
Yep. So let's go into our next segment here about statistics. So just to give you guys a little bit of eye-opening information, I thought this would be beneficial for you guys, especially. It really just puts in perspective how poor our health system is. So
well, I was going to say, we want to do different fun segments on the show. We want to get some feedback as to which ones you like and which ones you don't. This is the first one we're going to try out. We're going to call this statistics. We have a couple other in mind that we'll try on the next podcast, but this is the one we're going to do today. So let's just go over some statistics that we find interesting, eye-opening, sometimes horrifying, and let's talk about them a little bit.
So the first one is that the U.S. spends more on healthcare but ranks the poorest in outcomes. So to put in perspective, the U.S. spends over $4.3 trillion annually on healthcare, which is twice as much per capita as any other high-income countries. Despite this, U.S. ranks the last in healthcare outcomes with the 11 highest income countries. That's a problem. We also have the lowest life expectancy in all the developed nations. So not only do we pay the most for our healthcare, we live the shortest and we are the sickest. So obviously, once again, like our podcast, there needs change.
Yeah, I mean, that is just an absolute unfathomable amount of money to have a healthcare system with results as poor as ours. And, I actually think you have a lifespan on here of 77 years, and I think it actually went down after COVID a little bit. I want to say we're at 76. I'm not 100% sure about that. But this also raises that concept, this came up a few years ago, of health span and lifespan. So lifespan is the years you spend alive. Health span are the years that you are active and doing what you love to do. And last time I checked, health span in the United States was 66 years. So the average American is healthy, active, and able to do what they like until they hit 66. And then they're alive for, on average, 11 more years, not able to do what you like to do. So not only are we spending all this money with poor outcomes, we're not living a long time, and we're not even able to do what we want to do until we die.
Yep. And we're broke doing it.
Make it make sense.
Which leads me to our next topic, that when it comes to medical debt is the number one cause of bankruptcy for Americans. So 66.5% of bankruptcies in the United States are due to medical expenses. So once again, when you tie all this together, not only are we, broke as a country for our health care, but our patients that are suffering in this system are also broke for it and going bankrupt for it. Like, that should never, ever happen.
It absolutely breaks my heart in the emergency department when I tell somebody, I genuinely think we need to do this test or this scan, and they ask me, how much is that going to cost? Or they say, I don't want to do that today because I can't afford it. I'm like, oh my gosh, this is disgusting.
Yeah, that happened a few years ago when we were in the ER. Somebody didn't have insurance. He came in, he had appendicitis and he had some abdominal pain. He had no insurance, and we ran some labs, and he was like, I can't afford surgery. I can't afford to be admitted. He was a 40-something-year-old with kids. He walked out, and I remember one of our nurses chased him down the hallway out into the parking lot and said, please stay. This is life-threatening. Please stay. And he said, I cannot afford this. He came back 2 days later coding. I was working that day too. Came back 2 days later coding and died because of insurance. Like, that should never, ever happen. And statistically, more than 100 million Americans have medical debt. And over 40% of adults struggle to pay any of their medical bills.
We see this in our own family members. I mean, my own father will talk about what he can and can't afford in the medical system. And it's just sad because I don't think we're providing a good enough service that people should be broke to try to pay for it. It'd be different if we were the number one ranked medical country on earth. I might say, hey, you get what you pay for. But in the United States, I don't feel like we're getting what we pay for.
No, not at all. And healthcare is very unaffordable, even for the insured. Another statistic is that the average family health insurance premium is over $22,000 a year. And one emergency room visit out of pocket is going to be at least $2,600. I personally feel like that's on the low end, depending on what you're going to the ER for.
And I'll tell you what, even in this low acuity ER that I work in, I say this all the time. There will be people that sometimes come in, and granted, this is not a person's fault, because again, we are conditioned by the system. You watch the news every day and they say, if you have symptoms of the flu, go to the ER. And when I see these on commercials, I'm just like, why are you telling people this? Like, why aren't we simply saying, hey, respiratory illness is common. We know it happens every year. Take vitamin C, take zinc, take vitamin D. Instead, we're telling them to go to the ER. There are so many people that walk into the ER with very mild flu-like or upper respiratory symptoms. They're young, they're healthy. And I look at them and I say, I'm going to be honest, there's not a lot I need to do. I don't need to test you. There's not good treatment. I talk about vitamin C, vitamin D, zinc, hydration. They walk out. I guarantee you they get at minimum a $2,000 bill for that.
Yep, but they saw it on a commercial, which don't get me started on how we're one of the only countries that allows pharmaceuticals to be, promoted on TV
and
as well.
I think that wasn't like that before 1996, if I remember. That was in the late 90s that they actually started letting them. And I'm not even going to get you started because that's a completely different conversation as to why that happened. But tune in for later podcasts and you might hear a little bit about that.
So let's dive into the next statistic. And the U.S. has the worst avoidable death rate among wealthy countries, which means that people are dying from treatable conditions at a much higher rate. There was a statistic that I read that is 70% of chronic diseases are lifestyle related and preventable. Who tells you that? Nobody.
70%.
70%.
That's an astonishing.
Imagine if we could correct 70% of the chronic disease. And the biggest shocker of all that makes me so mad, the U.S. only spends 5% of its healthcare budget on prevention. Why? Because a sick patient is a very, a big business to them.
Yeah. I was reading a book just the other day and they shared this statistic, and I might be a little bit off. I'm doing it from memory, but this was back in the late 90s. The National Cancer Institute, the NCI, had a budget of approximately $4 billion per year, for all around cancer research, media, prevention, all of that stuff, right? They spent $1 million, which equated to 0.01% of their budget on teaching people natural remedies to avoid, getting cancer in the first place, such as diet and lifestyle interventions. Sure. Newsflash, if this is new to anybody out there, cancer is a preventable disease. The majority of cancers are a preventable disease. Yep. And another thing, and we'll talk about this later, your genes are not your destiny. I don't want to hear from patients that my mom had this, my dad had this, so I'm doomed to have this. Your genes are not your destiny.
And I don't think I would even have to say this, but I do because I get this at least once a week from my patients. But they'll tell me I have type 2 diabetes because my mom and dad had type 2 diabetes. And my doctor told me it was genetic. I just want to lose my mind. Type 2 diabetes is not genetic. Your culture and what you've grown up around and what you've ate, like lifestyle, that can be passed down. But they didn't give you their type 2 diabetic gene. They gave you the environment to keep that going. So that is, and I just had a patient yesterday. I told her she was in her 60s, never been diagnosed with anything wrong. She gets to me. I diagnosed her with diabetes. And she tells me, is this too late? Will I be on medication for life? And I said, absolutely not. You can do all of this without any medication if you would like to. And people are they're like, oh, thank God. I thought this was a death sentence.
That one reminds me of another really common thing we come across is these younger women who are trying to conceive. Yep. They're clearly obese and overweight. And you can just look at some people and know I guarantee you have some form of insulin resistance. Yep. These people have gone to primary care doctors, OBGYNs, fertility clinic, fertility testing, and then referred to fertility treatment, all without anybody addressing their insulin resistance.
Yep. And don't get me wrong, obviously infertility is a major issue, of course, with all the endocrine disruptors that we have. And I forget the statistics, but our male production of sperm is majorly decreased with all the endocrine disruptors. So they're a problem too. But nonetheless,
hey,
yes.
We can't be the problem here.
Yes, you guys are. But anyway, as far as the PCOS patients, I see this all the time too. And they'll say, I haven't had a period in a year. And my doctor, put me on metformin. Why? Because metformin actually helps blood sugar regulation, because nobody tells you that PCOS can be a huge insulin resistant issue. And I get this all the time. Patients will be with me and in a few months, they haven't had a period for a year. In a few months, they're already having, cramping and acting like they're going to start their period. So
within months.
Yeah, within months.
And that's why you hear about these Wegovy babies and
Correct.
whatnot, right?
Yep,
because all of a sudden, insulin resistance is being addressed on these medications. Women are having periods and getting pregnant.
Yep. And the other thing is the MTHFR gene mutation, which is ironic that we don't test that until somebody actually gets to a fertility specialist. Why is the knowledge not decades prior? Just by running a simple fasting insulin, you can predict diabetes up to 10 years prior to the diagnosis. And
10 years before you would do with even a hemoglobin A1C.
Yep.
And a hemoglobin A1C can help pick it up before fasting glucose.
Yep.
And how many people do you have in their 60s and 70s that you see that have never had an hemoglobin A1C?
Yeah. Weekly. weekly. If you're over the age of, I would say like 20 at this point, get an A1C. I see this all the time. I get 67-year-old, 70-year-old, and up. Sir, can you attach an A1C? No, I've never had that done. Are you kidding me? Next week later, I'm calling them saying, hey, guess what? The A1C was important. You're diabetic. And then they get so mad at their provider. And I see it all the time. So
it goes into, you said the preventable death rate. So US has the worst avoidable death rate.
Yep.
And some of those avoidable deaths are metabolic conditions like type 2 diabetes, metabolic syndrome, cardiovascular conditions, including heart attacks and strokes. Sure. And let's not forget autoimmune conditions, which are kind of taking over this country. Again, these are preventable, diet and lifestyle. Yep. But another one that's near and dear to us is mental health.
Yep, and 57% of adults with mental illness receive no treatment at all. The U.S. has one of the highest suicide rates among developed nations. Obviously, I think that our mental health needs so much more work in the United States. Another thing, it's very clear. I mean, science is very far behind in what we actually practice from what we find and study. But we know that there's a direct link from your gut in your brain. There's a direct connection. And if you have an unhealthy gut microbiome, you're going to be at significantly greater risk for an altered mental state, like anxiety, depression, suicidal ideation, etc. Yet majority of your medical providers don't even know what a gut microbiome is or how it functions. And there's just another reason for that. I can
honestly say that until probably 2 years ago, if you would have told me I consider myself a pretty smart person. I'm definitely educated. I've gone through the system. 2 years ago, if you would have started talking to me about gut microbiomes, maybe 3 years ago, about gut microbiomes and this playing into my mental health, my weight, my mood, my energy, I mean, I'm not sure I would have thought you were crazy, but I would have been like, nah, I don't think that's important as you're saying. But it is so much, it makes up all of who you are.
Yeah, we're about 5 pounds of gut bacteria. Like every single person carries around about 5 pounds of that. And we are more the gut microbiome, as in like the bugs and the bacteria, than we are our own DNA cells. So put that in perspective. Like it's really not us. It's actually our gut microbiome that is, housing everything. They can control thoughts, and if you have a poor gut microbiome, everything else is going to suffer.
Yeah, we'll give a little tidbit and we'll definitely do an entire podcast on microbiome. But one thing that I always tell patients who I'm seeing for weight management is that part of the effects when you're changing your diet over those first 90 days, your gut microbiome is almost being completely subbed out because you are what you eat. What you eat feeds the bacteria in your gut. And when you're eating junk food, your bacteria in your gut crave junk food. When you're eating health, nutrient-dense, fresh food, those bacteria flourish, and then you start to crave that. And patients don't believe me when I say this, and this is 100% true, my wife can attest to it, I crave an apple with peanut butter 10 times more than I crave a Big Mac. I can think of like once a year where I really want to go to McDonald's and eat a Big Mac. And I'm not going to lie, I'll do it. But I mean, nightly, if I have a craving, I'm going for an apple and peanut butter. I like to put cinnamon on it. I love bone broth. Like I literally crave a cup of bone broth.
And that's because of your gut microbiome that is talking to your brain. And there's tons of science. Like you guys can think we're as crazy as you want, but you act like when you crave something sweet, that is your gut bacteria saying, hello, I need some more of that food to survive. And that's why people go through a detoxifying period. When they stop sugar and carbs and crappy food, they're like, I feel like death. I have a headache. I have a stomach pain, whatever. That's exotoxins releasing their junk as they are literally dying off because you're not feeding them. And I tell my patients, just keep working through that. It'll get better. And once you kill off that bad gut bacteria, then the good gut bacteria can take over and populate. And then you start craving salads and weird things that you're like, who am I? Well, you were your gut bacteria. So now you're a different gut bacteria.
Well, we do always like to say that perception is reality. So if people think we're crazy, maybe we are.
I'm for it. I'd rather be on this side than the other.
What's the last statistic we have for today?
That's a good question. I think we already went over that chronic disease. But I did want to just repeat this because this is just insane. 5% of healthcare budget is on prevention and the rest is on treating conditions after they already develop. That is where the issue lies right there. We are reactive, not proactive.
Billions of dollars every year are going to developing the next big pharmaceutical drug. The pharmaceutical companies, the medical industry, they want that next GLP-1. They want that next Prozac. These are medications that changed the entire medical landscape. These are what we call landmark drugs.
Yep.
PPIs, SSRIs, statins. These are all landmark drugs. And 95% of the research funding, the grants, and everything goes to developing the next one of those. What if we just shifted 50%? What if 50% of the budget every year went to how can we actually educate people about diet and lifestyle? How can we give them tools? What if every family got like a grocery check every month where you could take this to any grocery store. It's government money. And this would help you buy organic fruits and vegetables.
Or community gardens where you, instead of massive parks, you'd have massive community gardens where you guys can go and plant what you want and go pick with your kids, especially for people who don't live on land like we do. We're very blessed where we live on land, and I still can't even get my garden maintained because we're so busy, but just have resources for our patients, which leads me to the next point of that these pharmaceutical companies want you on the medication lifelong because obviously you're going to be a lifelong patient, which is why here at Rixa Health, we are so different. If you read the back of any insert of, especially these GLP ones that we'll talk about, it'll tell you that you're going to be a lifelong patient on it, or this will be taken indefinitely. And that's not the case. And, of course, old habits die hard. And if you don't change anything to where to get you where you started with, then of course, everything is going to come back. But that's not our goal. And our goal is to give everybody knowledge and power to make those lifestyle changes, get away from this broken system, and understand when you hear something that's like, statistically or no, that's not right, like eating Cheerios for breakfast. If you guys are doing that, stop. And when you can recognize those things and say like, that's actually not right at all. Speaking of the food pyramid, which we could have an entire discussion and we will about the food pyramid and the corruption on how that even came into play. But regardless, we want to give you the most education that we can so you guys can go out and make an informed consent and be a healthier version of yourself without feeling like you have to hold your doctor's hand, a doctor that you might not actually trust or believe.
Yeah, I saw a cool meme that was shared with me on Facebook, and I'm not going to say the name of any pharmaceutical company, but let's just pretend, let's just call the name Farm A. Farm A has been in business for 185 years and hasn't cured a single disease. Do you think that's by accident? No, absolutely not.
Not at all.
They want us to be alive. They don't want us to die.
Yep.
But they do not want us 100% healthy because, like you said, then we're not coming back.
Yeah. The most profitable, and this is obviously a quote for people you're going to understand, but the most profitable patient is a young child, a young sick child. That child will be in the system for the rest of their life. Why? Because they don't address root cause, and then you have this polypharmacy systemic effect. Your body's like, what the hell? Year after year, you're developing new disease processes, autoimmune issues take over, and you got a lifelong patient.
Yeah.
Which unfortunately, it's a pandemic in itself.
Yeah. I thought that was really cool. I appreciate you putting those statistics together. And if we get good feedback, we'll do that more. In the last few minutes, you mentioned Rixa Health at the beginning, which is the telemedicine company that we're a part of. And you did mention, I completely agree with you. Our goal is not to get on here and promote that and, try to get a bunch of people. We do want people to know that there are options like Rixa Health and us out there where we do different things. And let's talk about that for just a couple minutes at the end.
Yeah. So for social media here, even if you guys never wanted to become a patient, that's fine. But we have social media. We have the TikTok, Instagram, Facebook, the Rixa Health. And that's just a great way to start getting some education as well. I try in all my spare time to share with us like what I do in my daily life here on the farm, working multiple jobs. I try to go to the grocery store and show you guys labels, how to appropriately read labels, just how to live a more clean lifestyle. And of course, during this day and age, it is so overwhelming and confusing, especially when I hear my patients saying, I don't even know what it means to eat healthy anymore because keto's bad, fasting's bad, this is bad, sugar's bad, but I want low carb, but look at the thousands of ingredients. It's too mumble jumbled. And I really want to get my patients back to, or anybody, back to the basics where it's just less ingredients, the better. Single item foods, making sure you're not eating seed oils, added sugars, dyes, processed things that you don't know what they are. So if you don't get anything out of this, we don't care if you do or don't want to become a patient. We just would love for you guys to even follow us on social media, share this for anybody that you think that could benefit for lifestyle changes, because it's a very hard world out there to be healthy right now.
Yeah, I agree. Rixa Health, we had experience with, and our first soiree into telemedicine was weight management and GLP-1s. And I do think there's benefit for those medications. We've seen a lot of people's lives change on those medications. And that's what sort of led to Rixa Health. But as we developed that, Mia and I have continued our functional medicine training, and we really hope to one day be a functional telemedicine platform, seeing lots of patients for different things. We have a visit on there right now that we call a proactive wellness and or custom labs visit. We get a lot of people who say, hey, I've asked my doctor to order this and that. They won't do it. Will you? And absolutely we will. We may not always be responsible for interpreting the results.
If it's something crazy,
because there is out of our realm, because there's things we don't know. I'm happy to admit that. But anyway, the point is we can go over your meds, your supplements. I mean, we can help you with a better lifestyle. But like Mia said, this is not to try to get everyone to be our patient. I absolutely agree with her. If you want to just check out social media, get some good tips. She makes tons of awesome videos. That would be really awesome. And we'll talk about Rixa a little bit more, but we want you to know that we're here for you. You have the power. We want to give you the knowledge.
All right. And just a reminder that this podcast is for informational purposes only and is not not medical advice. It's not a substitute for professional care, diagnosis, and or treatment. Always consult with your healthcare provider before making any changes to your health routine. Remember that you have the power. Join us next time to get more knowledge.
Yeah, that's good. Thanks, Mia. I really appreciate everyone who took time to listen to us. Please subscribe to our podcast and follow along and tell your friends.
Yeah, like, share, and follow. Thanks, guys.